Hello, we are here with Eric Strose. He's Chief Operating Officer of Dr. Consulta. Dr. Consulta is one of the leading technology-driven healthcare companies in Brazil. And we're going to discuss about how innovation is affecting the healthcare market in general terms, and especially in Brazil, in terms of access and quality. So, Eric, I know Dr. Consulta has has improved a lot in the past few years, but what was the original vision for Dr. Consulta and how has it evolved in the past few years?
Hello, Christina. Thanks for the question. First, Dr. Consulta is not a health plan. It's not an insurance company. It's a hub of clinics, a group of clinics that provides out-of-pocket attention in healthcare. We have 15 years now, and we are evolving by listening to our clients. In the beginning, we were, as the name says, Dr. Consulta is doctor appointment. So we provided only appointments with doctors. But with the time, we realized that the lack of appointments in Brazil is not the only lack that we could fill. We could fill more lacks because the patient had the consultation, had the appointments in Dr. Consulta, and need more exams and sometimes procedures. So listen to the client, we discover and go in evolving for providing blood analysis, sonography, MRI, CT scan, and everything that is needed to provide and to make the diagnosis and implement the treatment. So in the beginning, it was just an appointment, and now we have a full hub of offices, and more than that, a diagnostic center to provide the diagnosis and implement treatments. So that's the way that we grow from the past 15 years.
Thank you. And can you tell us a little bit about how Dr. Consulta is using artificial intelligence and data analytics to improve the services in general or particular to certain services?
Yes, we have our own ERP, and now we are using two systems that we tag the systems with some terms or some numbers and indicators that can read the reports, can read the blood tests, and tag for us what is important in that test. We are processing now more than 300,000 exams per month. So when we have to identify something that it's important to us, for example, blood pressure that is high, for example, a patient who is diabetic or have the hemoglobin glucose altered in the exam, the artificial intelligence can read the report and send an alert for the nurses from the health program to address the patient and engage them and make the follow-up with us, because we are helping them to don't forget about a schedule, forget about the agenda, to do the routine exam. So we are using this even for blood test and even for image testing. So they can read, for example, in a mammography, there's a classification that calls BHEADS. So when we have an altered BHEADS, it means that you have a good probability to be a breast cancer. So the artificial intelligence can identify the terms, the tagged term, and send an alert for the nurse or the medical crew to anticipate a return, to propose a biopsy, to identify this cancer and start the treatment. So now we are using these two systems to reduce the time for diagnosis and implement the treatment much faster than it used to be for this kind of patient.
And talking about the patient, how is this innovation and these changes, how are they perceived from the patient's point of view? How is the innovation affecting their treatment and their healthcare services? How do they receive it?
For them, it's very good because we have the app and we have the subscription card, and the patient has everything in their pocket because they have all the information. We have our own network. We don't have a contracted network. So the exams, the appointments in the hub, in the physical facilities, or the appointments in the telemedicine is all in one place in their pocket. So the information is all in their pocket. So everything that's this digital environment helps them and create value to them to have their health in their pocket and facilitate them to make the follow-up and the consultations, the appointments, and the exams when they need it. For example, if they need a telemedicine, he can do a telemedicine with Dr. Consulta to do a follow-up of an exam or an appointment that he made a month ago in a physical facility in the medical center. So all this technology aggregates value for the Dr. Consulta and value for the patient because they indeed have all the information in health in only one place. That's it's with us.
Well, as a patient and as a user of health, I think this is a huge change, honestly, and
Yeah.
I love it, really love it. And now let's talk a little bit, just for our latest minutes, about the future. How do you see the industry evolving in Brazil in particular, or in general in Latin America and the Caribbean? How do you see this affecting the healthcare delivery services, and how would evolve this in the next 5, 10 years?
I think that what we are doing now is the most important thing. That is what we believe. In Latin America, I think the most part of the people don't have a good access to health. We have a small part that is addressed by insurance companies, but it's a very small portion of the population with formal jobs and a good income for their homes. And we have the rest of the population that depends exclusively from the public services. And the public services is not enough to attend everybody in a proper way or with a good quality or a good time to attend, even in an appointment or in exams or even surgery, whatever. And the amount of people in these countries is very large for people who wants to afford something that is good quality, good time, and it's time dependent to schedule something, exam or consultation. And this market is huge. It's huge in Brazil and it's huge all over the Latin America. Who knows in the world? But I think this is going to be the next evolving of healthcare, specifically in Latin America, and we are trying to do this in Brazil.
Well, thank you very much. I totally agree. I think the market is changing, and precisely the private sector is bringing these innovations to change the market, to give accessibility, to give very high quality services. So I think the future is now and is coming. Thank you so much for being here with us today, Eric, and thank you everyone for watching us.
Thank you, Cristina. I hope everybody understands Dr. Consulta and what we are trying to do can be done in other countries for sure.